Another Metro Atlanta school has been closed due to the coronavirus.
And this school is in Cherokee County. Let's bring back Dr. Sharat Patel from Wellstar Health Systems. And let's talk about this. Is this an appropriate response when you have any kind of concern to just shut down a school?
I think this is a very appropriate response. They took into consideration that there was a positive case. Then they used a circle of influence and saw who might be exposed. They used that theory and then closed the school. I think this is a very appropriate response, and it is in guidance with the CDC recommendations as well.
We just got this memo from the Department of Public Health. It has asked the parents of the co-op students in those classes, both schools that have been closed down, with the diagnosed student to self-quarantine. But how can they truly be able to track everyone that these students have had impact in both schools? They've probably gone to grocery stores, to the post office, to the park
Baseball
to play.
practice, you name it.
We use our due diligence. It really is a best guess, and it's a team effort. We use community individuals to really take each other's temperature, really understand where they've been, and we also use the community's trust and judgment. If you've been exposed, you need to self-report as well.
We just listened to the press conference from Governor Kemp. He said that Georgians need to not be afraid, that there are new cases so far, and he says really the best way to protect yourself, as you mentioned earlier, wash your hands.
So I listened to the governor's remarks, and I thought he was spot on. He acknowledged everybody's fears. He acknowledged everybody's anxieties. I think he did a fantastic job outlining a path forward for coverage, for communication, and for treatment and testing. I think he did a really great job of acknowledging who you should listen to: local healthcare authorities, the CDC, and the governor's coronavirus task force. I think if you use those three areas of communication, the path forward is pretty clear.
But Dr. Patel, I'm going to guess that this is not going to be the first school that's going to be shut down, that we're going to have other announcements in the future, college campuses. I mean, we may see a whole string of places just shutting things down to try to clean things up and prevent this from spreading any further. But that alone can induce anxiety. We're all parents here. We're going to send our kids to school. Is there any problem with that?
So a couple of things. I try to steer away from the word shut down. I think what schools are doing are evaluating, implementing, and then ongoing. They're really using due diligence and caution for moving forward. And so in this particular case, I think it's appropriate to close the school and isolate the students. But going forward, I think schools are using their due diligence and they're preparing appropriately.
Let's go back to the governor's press conference. He mentioned that the state is now conducting those tests. Those test kits have come in. Walk us through the process. Are you privy to that information? What's in the test kit? What do you have to do if you get tested, and how soon do you get the results?
Great question. So there's three ways of testing. There's respiratory swab, which is droplets. There is a blood test, and then there's a stool sample. It takes between 24 and 72 hours to get the results back. It's run by the CDC, and there is a certain level of confidentiality in order to avoid mass hysteria and scare. And so the healthcare organization and the provider would get the results, and then the appropriate steps for supportive therapy would be taken.
So let's talk about your patients, for example. Someone who is young and otherwise healthy, you probably wouldn't be very concerned with, but we keep hearing about these groups of people that are most vulnerable, the very old, people with compromised immune systems, pre-existing conditions. What advice would you have for those people who really are most at risk?
I think you still stick with the framework of universal precautions. You need to wash your hands. You need to sanitize your hands. Don't touch your face. Wipe down hard surfaces. And then if your immune system is down or you have chronic conditions, as you mentioned, and you need to travel to the places where it's appropriate to travel. The governor has outlined where there's travel advisories. I would stay away from those. But in terms of going out to the grocery store, living your regular life, I think you still need to do those things.
Let's talk about, you mentioned the precautions to take with washing your hands, not touching your face, making sure those surfaces that you touch are cleaned and disinfected. There is, as Governor Kemp mentioned in his press conference, there are scams. There is documented price gouging simply on one of the websites of Amazon, over 100% higher than you can't get a mask for less than $300, although the governor said they don't work.
So both things are accurate. So there's price gouging for masks and consumer goods already going on. And so I think in the spirit of using universal precautions and doing what's common sense, you don't need a mask. So don't go on Amazon and buy one. The other item is the governor said those masks don't work, and that's accurate as well. You need an N95 mask in particular. It has to be professionally fitted on your face for it to work. And so don't wear a mask.
Well, we appreciate your time, Dr. Patel. Your insight is invaluable. But again, if you're just joining us now, the breaking news that we are following is that there is a school in Cherokee County that has been closed due to the coronavirus. This is the second school that has been shut down. We are continuing to follow the story.
Yep, we're going to push information through our CBS 46 app. So if you haven't downloaded, right now is a good time. Dr. Sharat Patel from Wellstar, thanks again.
Thank you.